Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about diabetes mellitus and its devastating effect to the human body worldwide. Around the world, there are 425 million people who suffer from diabetes mellitus, according to the WHO. In this country, you have 30.3 million folks who suffer with type 2 diabetes. And there's about, according to the CDC, 100 plus million people, thereabout, who suffer with what's so-called pre-diabetes. And I will explain to you that why pre-diabetes really is more of a theory than a reality. It really doesn't exist at all. Diabetes is diabetes, and I'll tell you why. In addition to that, diabetes is the 7th cause of death across the world, and diabetes is also the 7th cause of death in this country. In this country, you have 79,535 deaths per year, according to the CDC, that occur as a result of diabetes. Every 6 seconds across the world, somebody dies because of diabetes. This is a serious medical problem. And diabetes, of course, is a systemic problem because the glucose goes everywhere. And significant percentage of diabetes mellitus is due to the genetic transformation of it. You have inherited from one parent or from both when you develop type 2 diabetes. Type 1 diabetes, on the other hand, is an autoimmune disease that results from damage that occurs to the beta cell from an autoimmune phenomena, and people start having juvenile diabetes since they were 2-3 years old. To this day, we really don't know the actual cause of it. They're still investigating that. When I left off last week, I was talking about how obesity damages the liver and how obesity can cause diabetes mellitus. What I call type 3 diabetes, because there are many other conditions. I'll list some of them again for you, that can cause someone to develop the form of diabetes we call type 2 diabetes, namely obesity is one of them. Pancreatic failure is another one. Hemochromatosis, primary hemochromatosis, or for that matter, secondary hemochromatosis, that is iron overload. Once the iron is overloaded in the human body, it must by necessity get deposited in several different organs in the human body. And as the iron sits there, it must degrade. And the process of degradation results in something we call free radical production. And free radical is the basis for inflammation. And once the inflammation occurs, then the destruction of that organ begins. So that a lot of folks who have the form of diabetes we call type 2 diabetes did not inherit the diabetic gene from their parents. Rather, it's because they inherit other genes, such as the gene for iron overload. Then that ultimately leads to damaging of the pancreas, and the pancreas gets destroyed, and then they develop a form of type 2 diabetes. There are many, many, many other conditions that can lead to the same process resulting in type 2 diabetes. It could be a medication that damages the pancreas. It could be something that we eat, like ackee. If you were to eat raw ackee, there's certain in the part of that raw ackee that can lead to pancreatic problem. And if that persists, then you could ultimately damage the pancreas permanently. And I can go on and on with finding other examples, but you get the idea. So I really like to refer to those as type 3 diabetes. The manifestation of the diabetes is the same, but the causations are different. So now you understand. When I left off, I was in the process of discussing how do you go from being obese and you wind up being diabetic. Well, when you are obese, insulin is incapable of penetrating the fat cells. So therefore, the pancreas doesn't have a brain. The pancreas senses a need to keep dumping insulin into the bloodstream because it's not getting through the fat cell. And over years of dumping insulin into the bloodstream, the beta cell ultimately become exhausted and there's no more beta cell left, and you develop a form of type 2 diabetes. This is how obesity, then you cannot be obese and live long enough, don't wind up with type 2 diabetes eventually, what I call type 3 diabetes, through the mechanism that I just explained to you. That's inevitable. And to make matters worse, since insulin is an anabolic agent, anabolic steroid, the more insulin you have in your bloodstream, the more you crave for simple carbohydrates such as glucose, because the insulin has to feed on something, and the thing that insulin loves the most is glucose. So you feel hungry, you feel the need to eat more. So the more insulin you have sitting in your bloodstream, that's not doing you any good, but it's doing you bad because it's forcing you to eat even more. And then in so doing, you become even more obese, resulting in your more complication of the obesity. Obesity is a serious medical problem. It's not an aesthetic problem for people to look down upon people, because then this is a serious medical problem. And many years ago, when I was writing tons and tons of articles looking for academic promotion and whatever, to make contribution, academic contribution, I came up with the idea that obesity that is not endocrine in nature is a genetic phenomena that came from Africa. When I talked about it, I wrote about it. I had a little book that I think that may be over my shoulder here somewhere in the studio about diet that I wrote in, I believe, 1992, something like that, in which I explained all that. Because in Africa, it is the cultural thing. This is a negative comment. It's a cultural thing. Obesity is considered a sign of beauty. This is a true story. In Africa, obesity is accepted as a sign of beauty. So therefore, genetic is a very penetrating thing. Whatever it is you're doing it long enough, it becomes a genetic phenomenon. You could transmit it. And sure enough, the group of scientists at the Rockefeller Institute in New York City tested that theory, and it was proven, in fact, to be correct. Genetic basis for obesity started out in Africa. That's another one of the genes, of many genes that I trace myself, who's not a geneticist but a thinker. All these things started in Africa. So you may weigh 110 pounds now, but if both members or one member of your family is obese and you live long enough, you're going to become obese as well. By knowing that, then you could change your lifestyle if you're capable of doing so, if you have control over it, so as to prevent you from becoming obese and with all the other complications associated with it thereof. That's right. There's no way you could have parents that are obese and you don't ultimately becoming obese as well, because that gene was transmitted to you. It doesn't matter how much you weigh now. And this is a scientific fact. So by knowing that, then if you're in position, some people are not in position because of poverty. They're forced to stay with the lifestyle that their situation puts them in, and they're ultimately going to get obese as well. You cannot have parents who are obese, either one or both parents, and you're not ultimately becoming obese as well. All you have to do is live long enough, because you have that gene was passed to you. So now you understand, yes, there are other conditions that can somebody to become obese, but believe it or not, they are in the minority. But the majority will be of things that cause you to become obese is the inheritance of the obesity gene. How about that? And I'm here to tell you, obesity is a major, not a minor, major medical problem with a whole lot of associated complications. And one of the complications, of course, as I said, I tried to explain last week, is cirrhosis of the liver. We say, well, Val, how do you go from obesity, from cirrhosis of the liver? Well, when you take in all that simple carbohydrate, all of us need simple carbohydrate because you use the glucose and the simple carbohydrate as energy. When you eat it or drink it, it goes to the liver. It gets processed by the liver. The liver allow it some of it to be put back in the circulation for us to use as glucose as energy. Okay? The rest of it, believe it or not, get distributed throughout the soft tissues. That's the part I didn't get to last week. Throughout all the soft tissues, from the abdomen, the hip, the shoulders, you just name it. And it is only when those soft tissues become saturated with the fat cell, because it's going to become fat. Part of it becomes fat, part of it becomes glucose for us to use as energy. But the part that becomes fat gets distributed through soft tissues throughout the body. And once the soft tissues become oversaturated, hence the individual become obese, the rest has no place to go but to stay inside the liver. That's right. And it is the part that stays inside the liver that infiltrates the liver as fat. That's the part that, if it infiltrates the liver, it must by necessity find a way to degrade. The degradation process of the fat inside the liver inevitably is going to release free radical. The free radical inevitably is going to cause an inflammatory process to occur inside the liver, hence the beginning of the inflammatory process that leads to cirrhosis of the liver. That is why obesity is the number one cause of cirrhosis of the liver across the world. Number one. There are many other conditions, as I mentioned, like hepatitis, like alcohol abuse. All these other stuff can cause one to develop cirrhosis of the liver. But it turns out that obesity is number one. Okay? No questions about that. Therefore, then, one has to be very careful as to how one does things so as to prevent all these things to occur. Some of it you have control over, some of it you don't have control over. This is why I'm going to take some time now to talk about some of the early symptoms of diabetes mellitus. By knowing some of the early symptoms, you might be able to seek help early enough to prevent some of the permanent damage that diabetes mellitus is going to cause. And the basis for some of the early symptoms are different under different set of circumstances. And the so-called pre-diabetes, which basically doesn't exist. The reason why it doesn't exist, it doesn't make any sense, because by the time the so-called pre-diabetic individual become hyperglycemic, he or she would have already lost 80% of the beta cell function of the pancreas and would have been diabetic for at least 10 years. Give me a break. And this is a fact. By the time anyone who has the so-called pre-diabetes becomes hyperglycemic, he or she would have already lost, unknown to him or her, he or she would have already lost 80% function of the beta cell function of the pancreas, and you can't replace those. And he or she would have been having symptoms of diabetes for at least 10 years. Okay? That's one thing. And the individual who developed type 2 diabetes pronto, just like that, bypassing the so-called pre-diabetic stage, also have a series of early symptoms and series of late symptoms. All of them are bad. And in this segment, I'm going to talk to you about some of the early symptoms. Let's take first the symptom in someone who is not hyperglycemic. That is, the blood sugar is less than 124. Because in this system, the blood sugar is from 110 to 123. They categorize you as pre-diabetic. If it is 124 and above, you categorize as frank diabetes. Okay? All right? What happens is that when you're in the so-called pre-diabetic stage, so-called, which I don't think it exists, you must use energy. And the basic defect in the so-called pre-diabetic stage is that you are incapable of metabolizing glucose properly. And all that time that you are incapable of metabolizing glucose properly, the body needs energy. And the only thing the body knows what to do is to try to use fat as a substitute to make up the lack of glucose ability that is available to you to use as energy. Problem is, all the breakdown product of fats, the so-called ketone bodies, are very toxic. And they're going to start piling up in your circulation because you can't use glucose properly and you need the energy. And the ketone bodies are very toxic to just about every part of your body. That's the basic abnormality. Now, what are the symptoms? Well, for instance, let's take the obvious one. Tiredness, lassitude. You feel terrible all the time. You have no energy. Why? Because you don't have enough, you need glucose in order for you to have energy. You can't metabolize it properly. That's the basic defect. On top of that, without glucose, you can't make this up, but it's true. Without glucose, you cannot process oxygen very well. That's right. You cannot process oxygen properly to function because you need glucose for you to do so. When your glucose level drops down, people develop seizures because of lack of oxygen. How about that, okay? You have to take the time to really completely comprehend physiological processes of different diseases. Otherwise, you just can't talk about the finished product, so-called, without knowing the basic. Because if you have any discussions or constructing anything, I don't know what it is. You could be writing a book. You could be building a house. It doesn't matter. You must know the foundation. You must comprehend the foundation well so that you fix it well, do it well. Otherwise, you build this building with a lousy foundation. The least little wind that passes, you're going to knock it down because the foundation was wrong. The same thing with knowledge. You can't go and repeat stuff without knowing what it is you're repeating. Just because somebody says something or somebody wrote something and you read it somewhere or somebody teach you something, just the top of it, you have got to take it upon yourself to dig deeper, to understand the basics. Because when you are in trouble, it is the basics that's going to get you out of trouble. Okay? Therefore then, now you just understand why you're feeling tired all the time, why you're agitated all the time, why you're having insomnia, why you're having early depression. Because the brain is not functioning very well. The brain needs oxygen, but you can't process oxygen properly if you don't have sufficient glucose on board to do so. And for you to have sufficient glucose, you must be metabolizing it. Well, in the so-called prediabetes, the basic problem, you cannot metabolize glucose properly. And I want you to understand, I learned this thing on my own. I figured these things out on my own. And I went to a fantastic, great medical school, Albert Einstein College of Medicine. And I went a super training program, Montefiore Hospital in the Bronx. Fantastic. I recommend it. And that taught me well, but that taught me what they knew. Every single day, 85 to 90% of what I do in the practice of clinical medicine, or what I teach, or what I write, what I lecture, I learn on my own. It wasn't the job of my teachers to teach me stuff I mean, I went through my training in 1973. Look at how much that has evolved since 1973 when I was an intern. I finished my training in 1978. Look at how much have happened. How is it that it is the responsibility of my grade school to have taught me? Nobody knew this stuff then. They taught me what they knew. And they were great teachers. So you can't just go to medical school and learn what you learn and take it into the community and do nothing else and think you continue to provide quality care. How is that ever going to happen? Things are changing 24/7. I have stuff, today is Thursday, I have stuff that I didn't know yesterday, Wednesday, that I just learned Wednesday. Okay? All right? And I thought I knew it. I didn't know it. I just learned it yesterday. So you have got to keep up. And basically, and it's not easy. Believe me, the practice of medicine is very difficult. My colleagues and myself included, we are working 24/7, providing care for patients. Some of us are forced to see 30 patients a day. Not me, but some of us are because they're working for medical groups. And if they don't produce enough, they don't have the bonus at the end of the year, and they have families to take care of. They're leaving the training program in medical school owing an average of $260,000. And some of them have not even finished paying their college yet. They still owe money for the college. So they have to go out there and work. And they're tired. They get home, they leave home at 4:30 sometimes, especially the surgeons that have to be in the OR early. They don't get home sometime until 9 o'clock. And then we're on call for, I'm not making excuses for them, but I want you to understand how tough this stuff is. It is not easy. These people have mortgage to pay. They have family to take care of. You can't fault them by not reading all the time. How are they going to find the time? It's not easy. And I'm not here blaming it. I'm just planning to give you an idea how difficult clinical medicine is. It is a tough job. It is a lifetime 24/7. Especially for somebody like me. I practice by myself. I don't have an associate. I don't have a partner. I have to answer the phone 24/7. But I've devoted my life. I cut everything else off. This is all I do. Medicine is not just my profession. I turn it into a hobby as well. So this way, it's easier to deal with it that way. I think it's just because it's my hobby. It's a very serious hobby. Yeah. So therefore, then you got to know why you're having the numbness in your foot, the tingling, all this pulse sensation. Well, the red flag should begin to go up because there are many things that can cause you to have no energy. If you're anemic, you wouldn't have any energy. But here it is, you're just finding out just because you cannot metabolize glucose properly can cause you all these things. Could have a problem with your eyes. Some people can have a little minor cut. It won't heal properly. You should begin to say, well, how is it that this simple cut is not healing properly? Well, guess what? You ready for this? The white blood cell, you can't make this up, the white blood cell of people who are diabetic has difficulty migrating from the bloodstream into the area where the wound is. That's right. That's a basic abnormality. When you are diabetic, of all the chronic complications that I'll be talking to you about next week, you have to understand your white blood cells are not functioning properly because they cannot. There's an interference with the migration of the white blood cell toward a particular wound. That's one reason. Okay, the chronic complications are worse, and I'll be talking to you about them next week. So you have to understand when you're having these symptoms, you should take them and explain them, write them down, take them to your physician, explain to them what is going on. And when I begin to talk about evaluation of diabetes, you will learn all that stuff. I will tell you what you got to do. It's your doctor, not me. Medical, legally, I cannot tell you what to do. But you will understand what needs to be done so that you don't wait until years later to find, oh my God, I was diabetic. You've been diabetic a long time. You were having serious symptoms a long time. You just didn't know it was because of diabetes. And in the meantime, thousands of dollars are being thrown away looking for all of the fancy, expensive stuff, and not a single dollar is being spent to look at the basic reason why you're feeling so bad. Why are you exhausted all the time? How can you not be exhausted all the time if you're not metabolizing glucose properly? Because you need glucose. You need glucose for energy. You need glucose to process oxygen. How about that? Okay. Now, having nothing to do with hyperglycemia. When I get to hyperglycemia, you will be shocked to find all the other terrible things that elevated glucose is causing to happen to you because it is elevated. Okay? You will be amazed. So suffice it to say, as I said a couple of shows ago, it is the job of a physician to listen to the patient. Listen to the patient. Don't cut him or off. Listen, because he or she is telling you what the diagnosis is. It is for you to have enough experience, enough knowledge to get the cue that he or she is giving you. She's telling the truth. You just have got to, as I was telling a student last week, the two most important things you have to do well in the practice of medicine, clinical medicine, is how to interview and how to examine. The interview is crucial. The examination is just as crucial because you might pick up stuff that the patient knew nothing about, he or she didn't even know, didn't even tell you about. And you got to listen to the interview. Don't cut the patient off to know that he or she is just basically telling you. But you have to have the knowledge. The knowledge has to be vast. It can't be limited. It can't be narrowed. It has to be vast. And unfortunately, we have a situation right now. We have individuals that must make a living, but they should not be practicing medicine alone. These are good people. These are good people, but they yes, they can practice, but they have to be practiced under supervision. Medicine is too complicated, too serious. This is some people's lives that are in your hand. I have been a patient multiple times myself, and if I were not a knowledgeable physician, I would have died a long time ago. Listen, I'm going to stop here until I see you again. This is Dr. Alcena saying so long and bye-bye.